stomach cancer diagnosed? Is it a blood work? Is it the endoscopy?
Right, so it's a combination of things. If we see a patient in the office at the cancer center who we believe has gastric cancer, usually they've had blood work done, and primarily we're looking for signs of anemia because we did say that patients can have dark stools and blood loss through the GI tract. So symptoms with anemia are worrisome.
Okay, so you're checking the hemoglobin.
Right,
okay.
Exactly. From a procedure standpoint, we can do an endoscopy where they basically put a small tube-like camera in through the mouth. It goes through the esophagus into the stomach, and there we can assess for things like gastritis, inflammation of the stomach wall, ulcers, tumors. If you find a tumor, it can be biopsied. Later on, we'll talk about H. pylori and its role in peptic ulcer disease. They can do biopsies to document the presence of an infection, which is commonly related to gastritis and gastric cancer. So there's a lot of information we can get from an upper endoscopy if we're looking for that.
I read something called, and if I say it wrong, please forgive me, but barium swallow?
Yes, so this is a non-invasive study where a patient drinks barium sulfate. It's basically a metallic liquid that's picked up on x-rays. So the patient sits in front of an x-ray machine, drinks the contrast, and the radiologist can assess how it goes down the esophagus, can look at the anatomy, can see whether or not the stomach is contracting well, can assess for benign things such as reflux, but importantly, it can look for any kind of filling defects, any type of a thickening of the lining of the stomach, something to suggest the presence of an ulcer or a tumor. If something's found, then the patient's going to get a follow-up endoscopy to evaluate what they saw on the barium enema. But it's a barium swallow. But it's a non-invasive way of taking a closer look at the stomach.